Charlotte Stirk here, reporting from Indian Rocks Beach in beautiful Florida. Not a lot of people on the beach. Just look at that. And it's the funniest thing, you know, I brought my paddle boards out here and I just copped a squat. I don't know if that's right to say, but look who I ran into.
Hi.
This is Miss Brooke Sargent, aka author, RDH, office specialist for Burst Oral Care. We happen to have a lot in common, and look at her. She just also copped a squat on this roundy with me here. So I thought, you know, we're in the same place at the same time, and I when you're at the ocean like this, Brooke, it's so peaceful, it's so relaxing. It makes you want to just take a stroll and have a chat. Will you stroll down the beach with me and have a chat?
Absolutely.
What do you want to talk about?
Whatever you want to talk about.
Oh, okay. Should we
I'm open.
maybe do some, I don't know, Seaside confessions?
Sure. As long as it's not too personal.
I can't promise that. I have some questions for you.
I'm
All
ready.
right, let's take a stroll.
Let's go.
Brooke, have you ever dated one of your patients?
No.
That's it? No?
No.
Have you ever wanted to date one of your patients?
No, I've always been married. I married straight out of, I graduated hygiene school and then I got married, so there was never an opportunity.
Okay, all right.
But I've had patients that have wanted to date me. Let's
Let's hear about that. Okay, so favorite pickup line from your chair?
What would you do to me if there was a door on this operatory?
Oh, that's classy.
And my response was the same thing I'm doing right now.
I love it. I had someone look straight at me while they had the suction in their mouth, and they were like, I bet someone would have to have a really healthy, wonderful mouth to make out with you. And I was like, yeah, and unfortunately you don't. You're in pretty bad shape.
That's the thing. They never realize.
And of course he responded with, but when I come back and I get through all these root planing procedures and then my mouth's healthy, then there's a chance, right?
Yeah, no, it's already been spoiled. Nope.
Nope.
All right, Charlotte, have you ever intentionally stabbed, poked, hurt someone during a cleaning?
So I intentionally, I didn't necessarily stab someone on purpose, but I did intentionally give them cherry Vaseline as a fake topical, just to prove that they didn't need topical.
That's great. I've done something similar.
Because it was, you know, when someone sits down, you haven't even seen them ever before, and they're like, I need a lot of topical, I'm very sensitive. And I was like, I mean, this went on for 5 years, and I was just done with it. Because you know how you kind of test it out?
Yeah.
You like scale real hard, and then you're like, they're fine, they're not even reacting.
Right.
And so, yeah, I actually bought some it was either cherry Vaseline, I think it was.
That's a good trick.
And I was like, this is a new one, it's cherry flavored. And they're like, oh yeah, it worked really well. So I did confess at the end of the appointment, I was like, I have to confess that was not even topical.
Oh, you shouldn't have confessed.
And you're totally fine. So I want you to know that it's completely mind over matter. And they didn't get mad. They were okay with that.
Oh, well,
We had
good.
a little laugh.
No, that's good.
Okay, Brooke, what's the most embarrassing thing that's ever happened while working as a hygienist?
Probably was at a new office, and I was trying to be super impressive to all the dental team, and then of course the patients, and I went to sit down and totally missed the chair. I was going to plop, so I hit hard on the floor to the point that it took my breath away.
Now, did you laugh it off, or did you get up real quick, or were you like visibly embarrassed?
Like everything
'Cause I
above.
would've clapped at you.
No, I was like all of the above, because the patient he didn't know what to say, and I kind of laughed, and then I jumped up and I ran away because I was in pain. So I needed a moment to just get myself back together.
I actually tripped on an ultrasonic cord as I was walking out, and you know how you kind of do the three 3 hops into the hallway.
Yeah.
And then hit the wall on the opposite side. And you just laugh it off. That wasn't most embarrassing, but I think we've all fallen down at some point.
Yeah.
I've missed my saddle before and kind of ended up on the floor.
Yeah, it hurts. Really
And
bad.
you know, the patient's like, "You doing okay?" I'm like, "I was just checking the settings back here, make sure we're all
good.
We're all good."
Have you ever done anything specific to accommodate a patient?
Well, yeah, I've accommodated every patient that's ever come in the chair. You want to sit back? Fine, I'll stand up the whole time, no problem. So
Out of the normal.
yeah, okay, so I was all about the patient, and I would get like annoyed at how insurance driven we were. Like I always felt this. I was torn between like the right thing to do for the patient and the right thing to do for the practice, which you can do both at once. But anyway, I'd say the first example that comes up, like if I'd been telling a patient, you know, this is still on your treatment plan for a long period of time, and I found out we had the time to do it that day. If I knew that the patient was not going to come back, because you know how they always say, "Oh, I'll call to get that appointment set up." So I would, without really asking anybody first, and it usually turned out to be okay, but I would say, "Okay, well, if you can stay today and have that filling done after your cleaning, we'll take $20 off, you know, because you're already here and it's important, you need to have it done."
Right.
And it saves us time and money and energy on, you know, bringing you back and phone calls and all that kind of stuff, chasing you down. So I would just like modify prices a little bit, which I think that's a good practice management strategy.
I do. I think
like
so too.
quadrant dentistry,
Yeah.
may be a good example of
They
that.
may
So
have never came back. So
yeah, so there's your practice management tip from Charlotte. Just don't be so insurance driven. Like, it's your practice, you can do what you want. I can see why doctors don't want to take insurance.
yeah, me too, definitely.
And then just say, "This is what you need and here's the price," and then you can change the prices however you want.
Yeah, I agree, 100%.
Yeah, so it might be whale. Does that look like whale? Like a small whale?
That is disgusting, is all I can say. Why is it here?
Well, why is it here? Because it died somehow. All right, so something died and it's got some fins, and I'm thinking it's a small whale of some sort. And Brooke is absolutely freaked out about it. They live in the ocean.
Exactly, that's the sand. That's the beach. It needs to be there. Here's the Kentucky. I thought that the first thing that I thought was deer carcass.
Yep, we have deer and moose that wash up on shore. This one's a little bit more serious. Have you ever noticed decay or a problem, any kind of dental issue with a patient? You noticed it, and then you forgot about it, and the doctor didn't see it, and then the patient walked out the door?
Yes. And on my defense, it was on an x-ray that I had forgotten to look at. So what I ended up doing...
In her defense, she forgot.
Yes, I forgot. And so I forgot I had taken the bite wings. And so doctor, I checked the patient.
Did you take a lot? Listen, you take a lot of bite wings. It's easy to forget one set. I'm trying to defend you also.
Yes. So then after the patient left, I was like, oh crap, I forgot to look at their x-rays. So I looked at their x-rays and there was a monster cavity. I didn't even tell the doctor. I just called the patient and was like, hey, just forgot to tell you that when we looked at your x-rays, we saw a cavity. We just forgot to mention. Just acted like, you know, we just forgot.
That's good. Well, you made it right. You called. Yeah, I actually chased somebody down in the parking lot to be like, oh my gosh. We looked again, because we always do. We always look twice at x-rays. And you do have something going on. I'm just going to go ahead and set that appointment up for you.
Yeah.
Oh, that reminds me. Have you ever taken a chart home? Did you have paper charts?
Oh, we still have paper charts.
I've found them in my house later because I was just going to write up notes later or look at, I don't know why I would take it home. It ended up in my backpack.
I've never taken, now I've had x-rays of patients on my phone like a year later, but I was doing it for the front office. She needed an x-ray, a picture of an x-ray, because we're film. And so she was putting it in the computer, but no, never a chart.
They're film. They need to catch you up a little bit. Where are you from?
Well, I'm from Kentucky, but I live in Tennessee.
Aw, bless your heart.
So, Charlotte, what is the funniest thing you've ever said to a patient?
Oh, this was like my second day on the job at my office that I was at, like 18 years. Older patient, I mean, probably close to 90. And we did an impression for something in the other room. And then I came and introduced myself. I'm your hygienist for today. I'm going to get you cleaned up because he had some alginate on his chin. I was like, I'm going to get you cleaned up and take you back to my room. And hit really loud. He's like, well, that's the best offer I've had in 60 years. I was like, all right, here we go.
Here we go.
What about you? Any funny conversations with patients that like stand out?
Yeah, so I have a lot of sayings that originate from the area that I'm from. And so I'm constantly just letting those spill out like everybody understands them. So I'll say things like, we'll get you done in a lick. And obviously people don't understand that, that patient thought literally lick, like I was going to lick something.
It's highly inappropriate.
Highly inappropriate. Or, just things like, I don't know, like I'll say, we're going to go upstairs, and I mean that I'm going to work on the maxillary, and I've had patients literally get out of the chair, and they're like, okay, let's go. I'm like, no.
Sit down.
Like upstairs in your mouth.
I told someone they had a lot of spics under their gums, and they were Latino. They started laughing, and I'm like, wait, oh, spicules. I'm so sorry, spicules. That's a technical dental term, not spics. That is not PC. Yeah. No, wait a minute. All right, Brooke just confessed that she had a patient pull his pants down. You got to explain this one.
Okay, so he had gotten a new tattoo, and we were talking about tattoos, and he really felt like he needed to show me the tattoo. So he said, let me show you my new tattoo. Didn't tell me where it was at. I was like, okay. So I turned around.
Don't tell me it was a snake, please. Please, don't let it be a snake.
I don't remember what it was because I turned away very quickly, because when I turned back around, he is standing in my operatory with his pants down. I can see his entire bottom. And I just turned around. I was like, yeah, that's great.
People at home, don't do that.
No.
Ever. We don't ever want that to happen.
Wrong end.
It's not funny. Right. We're oral specialists of the mouth. It's a little humid out here.
Yes.
It's confession time. Do you love the water?
I do love the water.
Do you love going out into the water?
That's going to be a negative.
We're going to take the confessions out on the paddleboard. This is good therapy. This is what we do here at Burst. Is like we understand that when you get uncomfortable, you grow. Oh. So Brooke is going to grow today. Stay tuned.
Oh shoot!
Major update here. Apparently, Brooke called God and said, "God, I don't want to go on the paddleboards," and He rained down upon us a miracle. Yep. Because guess who forgot to put the paddles in the back of the car? You should have seen the look on her face. I was like, I forgot the paddles. How could I forget paddles?
That's the best.
Man, that's the worst. I was about to rent some paddles too.
It's like when you think...
I'm mad. I'm so mad at myself.
It's like when you think you're pregnant and you're like, oh my God, I've got to take this test. And then you're like, yes, I'm not pregnant. I'm not pregnant today. That was great. Test was negative.
Shoot. Next time. Anybody else want to come on Burst TV and do some Seaside confessions? I'll take you out on paddleboard. Anybody? Any takers?
I say Missy.
Just leave your name in the comments.
This is where sharks migrate.
There's no sharks here.
Yeah,
There's way too many people. We're good. So I'm gonna ask you some questions to get your mind off of it. Like,
so when I die, when a shark just swims up and bites me, then I'll be distracted.
I will protect you. I put shark repellent on this morning.
Okay, perfect.
Brooke, how do you feel about the 4355? Like, what do you really feel about that? Like not what insurance companies say, not what not what you're supposed to say. Like, how do you feel like it has it played? Tell me all about
I use it. I use it, but I feel like a lot of times when you use that code, just patients feel like that's it. That's a cleaning.
Yeah.
They're not going to come back. They're not going to follow up because a lot of people don't understand, and as long as they get the dirt knocked off, they're happy.
Right.
And so, honestly, do I use it? Occasionally. But, I don't know.
Yeah, I feel like, you know what, something else takes priority, like that broken tooth, but I cannot leave all of this baloney on here, and I can't even give you a real diagnosis of what's going on. So,
yeah,
you know, I think it has its place.
It does.
But I don't like people telling me when I can and can't use it.
True.
So I much prefer when people didn't have insurance and I could do things in the order that I felt I needed to do them.
Yeah, absolutely. No, I completely 100% agree.
There you go. See, I don't believe it. She's not afraid at all.
I am. I'm a little leery. Yes, I am. Like, this is
you wouldn't be out here by yourself.
No.
Okay.
Never.
Well, that's good. This is a buddy system. Come with me. We're gonna swim out here into the wilderness.
No, this is where sharks are at.
They're not. They're way out there. I told you I put shark repellent on. There's a sunscreen that they hate.
Here, let's record my last goodbye statement. Oh, it looks like a snake.
Oh, it's a little needlefish. Touch it. Oh, do you like giving anesthetic?
I don't give it enough. Like, I went back and got my certification.
Yeah.
And I feel like I don't give it enough to be proficient in it. So,
You don't love it?
I think I would like it more if I was more comfortable.
Yeah.
But I feel like a lot of my patients who need it end up going to perio, periodontist.
Yeah.
So I don't, and then those who probably could benefit from it are like, I'll just withstand it. So they don't ever let me.
I like to have that skill in my back pocket where it gave patients the option. So if they're like, oh, I'm really sensitive and we're getting ready to do some scaling or something, like, well, we have options. Like, I can do a topical, I can do a super duper topical, because that's the technical word for it, that lasts a little bit longer. I can do an injection. I can do a little injection. I can do one that's like really gonna get you numb. So I'm like, do you want to feel nothing on your face or a little bit of something? And so sometimes I could just do a little infiltration, and they would, again, maybe it's like the placebo effect. Yeah. You kind of gauge how comfortable people were. So it was nice to have an option. But I don't know. Sometimes the block, like just the sound of needle insertion going through a ligament or hitting bone. I didn't love that. No. Do you like assisting?
No.
You don't? Oh, okay. So I got you.
No.
Brooke does not like four-handed.
No, I don't.
Are you on the wrong side of the chair and it's like
wrong
feels
side of the chair? I just feel so out of my element. It's not anything that I know when I hate it. Like, I hate it when I have to go in there and he needs me. No. Because one time I sucked up somebody's eyelid. Like, and how do you do that? Because I let the water get up on the eye, and I was like, okay, I'll just suck it off. No, don't ever use a high volume suction on the eyelid. No.
Do you like doing sealants?
Love sealants.
Yeah.
I use, number one, when you use wet bond technology, it just makes your life so much easier.
Embrace?
Yeah. So, because you don't have to worry about, a completely dry field. I use dry angles and cotton rolls, and just go for it. Pretty much, that's it.
I did like the relief for like really spitty kids, but usually by the time you get all that stuff out, it's like, just put your head back in the... I don't know. I never had a problem with it. Some people hate sealants. I like sealants.
But I tell you what I hate. I hate probing.
Yeah.
I don't know. It's just, I feel like it's time consuming. It's very important, but...
Don't you have a Florida probe? Don't you want to tell your boss to get a Florida probe?
I want to tell my boss to hire somebody to probe for me.
What's your favorite hygiene procedure that you could just do all day long? I mean, really, there's only so many.
Yeah, I know, right? They're really, honest to John, I really like when somebody comes in and they just have that solid bridge of tartar. I'm just like, yes, come on.
Yes, let's get it.
Yes, and it's like complete satisfaction when it's gone. You're just like, I did that. Totally did that.
Look at that. Let's get the mirror out. Let's take some pictures before and after. Yes, instant gratification.
Yes. I love the sound of subgingival calculus, like those little spurs and that little click sound. It is, that gets me every time.
Well, I just want to thank you, Brooke, for spending some time with me. I appreciate you driving all the way down here to do some Seaside confessions.
Yeah, that's my burst commitment right there.
I'm sorry that I forgot the paddles.
I will forgive you.
I know you're disappointed.
Yeah, like just crying inside.
But I think we learned a lot about you today. Oh, the other thing I wanted to ask you about is you also write for Today's RDH. Is that online or printed as well?
It's online, strictly online.
And how often do you contribute?
Once a month.
Do they give you titles, like trends and stuff like that, or do you come up with your own?
Both. So if I'm on a writer's block, I'll ask her, or if I say, do you have a particular topic you want to, me to cover, she will pitch me one. But she gives us a good little spiel of topics that she'd like covered per month, or you can just do your own. So I just kind of go with whatever my gut tells me that month.
Isn't that nice? That's a good way to keep your brain going.
Yes.
Like to really keep up with.
Yeah, and I'm a nerd.
No, that's why I like Burst TV, because I get to talk to people that know a lot of stuff, and because I'm not in clinical anymore.
Yeah.
So I can at least stay in the loop a little bit and pretend to know what I'm talking about.
No, I love research, and I love, honest to John, I could sit here and give you some crazy specs, but I love the research part of it, so that part of tapping into that, and like if a patient asks me something, I can tell them whatever they want to know, and they're really surprised. Like,
I bet you're also the one in the office where they're like, I don't know, go ask Brooke.
Truly, they are. Yeah. So, but I like having all that knowledge.
You are my people.
It's good. It's good.
And how did you get started with writing?
So,
because a lot of people not a lot. We probably have 2 people that'll comment on this video, but that want to know. Sorry, we are in a very niche category here, but dental hygienist that's also working clinical that wants to, you got an itch, you want to do something, I wonder what that's like. Like, how do you break into the whole writing scene? Well,
writing has always been something for me that I've always loved to do, and I actually have a minor in journalism. So anyway, I decided that was something that I might like to do one day, is to try to do, because I would always, subscribe to all these magazines. And when Today's RDH first launched, prior to her launch, she put a pitch out on Facebook asking for people to submit a request to become a writer, and I submitted, and she accepted, and I was there from the beginning.
How long ago was that?
2 years. I think January 2018, and I've been there from the very beginning.
Awesome.
Yeah.
Congratulations.
Yeah. I like it. It's fun.
A lot of fun. We have she's actually a dental celebrity to write for a magazine like that.
It's really awesome. Cool, and I get a lot of a little emails or Facebook messages from just complete strangers asking me questions about, hey, I read your article, can you clarify this, can you give me advice? I even had a nail tech's husband who read my Loop article, wrote me a message on Facebook and said, hey, do you think these would be good for my wife as a nail tech?
Oh.
So that, you just never know what to expect.
Awesome.
So it is kind of cool. Or I'll see somebody and they're like, hey, you write for Today's RDH. That's me.
Well, thank you for hanging out with me today.
Yeah.
And anybody else that wants to come and hang out on Burst TV, or I could come to you. Someday I'm going to have the Burst mobile.
That's going to be awesome.
And I'm going to drive and crash couches and stuff like that. But this is an okay way to spend the morning, too.
This is perfect. This is great.
Thanks, Brooke.
Thanks.
You guys have any questions for Brooke, or you guys want any topics covered? If we don't know about it, we'll find out about it. We'll do our research, and we got you covered.
Yep.
See you next time.
Bye.